Thank you, Mr. Chairman. And thank you both for being here. Certainly appreciate your testimony. And thank you also for working to get that mental health information into the national database. I know it may have been a thorn in some sides along the way, but I certainly appreciate your efforts in working with us on that. Along those lines, how often is that data being transferred moving forward? You know, I know that you did the kind of the bulk, what I'll call bulk dump of data back, I guess, in January. In terms of your own policies and protocols, how often will that be occurring? How quickly is that data getting to the national database? And will you continue it, whatever that rate is, moving forward?
Yes, we upload the information to the NICS nightly, so it happens on a daily occurrence, and we receive about 3,200 a month.
3,200 involuntary commitments.
Yes, sir.
A month?
Yes, sir.
And that information is going nightly?
Yes.
That's terrific. Thank you for that. And and I know that you're currently not required to do this legislatively. Internally, I mean, how can you assure me that that's going to continue occurring and continue occurring at this rate?
As long as the NICS continues to accept them, we will continue to send them. It was a goal that we have strived to achieve for several years, so we're very grateful that we're able to accomplish that and be able to submit those on a regular basis.
I appreciate that. Thank you very much. Along those lines, can you describe for us some of the differences or really some of the data that might be obtained through through PICS that is not available through NICS? You know, if you could just kind of break that down for us. I know that, I guess you mentioned about a dozen states or so are utilizing their own system, and I'm just trying to gain an understanding, a thorough understanding of what information is available to those retailers who are conducting those background checks in Pennsylvania by using the PICS system as opposed to the NICS system.
Well, at least as far as Pennsylvania is concerned, our PICS hits on a number of different databases, and many of them are separate, distinctly different databases. Some of the information we can upload to NICS, like the mental health records. Some NICS will not accept because the standards within Pennsylvania are not the same as the requirements that NICS has established. For example, many PFAs, NICS has a requirement for certain fields to be completed before they will accept a PFA in the national system. Pennsylvania does not have that specific requirement, so currently there are about 1,570 PFAs that are accessible only through a NICS query.
I'm sorry, 1,570?
Yes.
Okay.
Available only through a PICS query and not accessible through a federal database. I talked about rejected fingerprint records for criminal history arrests.
Could you elaborate on that a little bit? As a former prosecutor, it's a little troubling to me that some conviction records may not be available through NCIC.
It is troubling, understandably. There are thresholds for acceptance of fingerprints that are submitted to the FBI. Now, please understand, fingerprints are still submitted through ink print cards, which are clearly not as efficient as a live scan submission, which is an electronic submission. So all of the fingerprint submissions come through our AFIS system. We kind of enhance them as best we can before we submit them to the FBI. However, approximately 2% of them get rejected on a regular basis. Those rejected prints are typically sent back to the submitting agency to acquire a more acceptable print. We're not sure the frequency of resubmission that occurs in acceptance, but the numbers are troubling, and those criminal history records are not contained within the national III system.
Could you said 2% are rejected. Are you able to, and I don't mean to put you on the spot, are you able to give me a number on that, to quantify that over just a year's time? It's
approximately 400 to 500 a month.
400 to 500 a month are rejected.
Yes, sir.
And so does the state police, and I'm not suggesting you should by this question, I'm just asking whether you do, is there a tracking system to determine whether or not those agencies who submitted the inadequate fingerprints are following up to get adequate fingerprints in submitting them?
There is not. We just don't have the resources to do that. And please understand, this isn't a situation that's unique to Pennsylvania alone. This happens to every state in the nation. As
Right.
a matter of fact, we made a query, and we're about middle of the road as far as the percentage of rejections from the FBI. So it's not unique to Pennsylvania.
Do you have it by agency, those agencies with outstanding, inadequate fingerprint records? Because while I understand your level of resources may be strained, perhaps maybe some public awareness about which agencies are not following up and getting those fingerprints done properly would be helpful.
Yeah, and we are exploring that. For the past couple of years now, the state police have been working closely with like the PA Chiefs Association and PCCD with a fingerprint compliance group. And the main objective of that group was to increase fingerprint submissions initially, because there were many criminal arrests being made and the fingerprint submissions were not being sent to the state police. And of course, a criminal history record does not exist without a fingerprint submission. So we've been working closely to and have made great success in increasing the number of submissions, and now we're working toward increasing the quality of those prints to be submitted. And please understand that the Pennsylvania State Police accept these prints. We believe that it's better to have a bad set of prints and get the records in the file rather than to reject them.
So do you have a listing by agency of those with outstanding, inadequate fingerprint records that you could get to us? I'm not saying now, but I mean...
I don't know. I'd have to check on it.
Okay. I'll follow up with
Yes.
you. Again, I appreciate all your help today and all the information. Thank you very much.